Hello, I'm Dr. Rob Hicks and I'm a practicing GP. I'm delighted to be involved in the Treat Yourself Better campaign from the PAGB and Pharmacy Voice, so I can help people understand more about common winter ailments and when it's important to seek medical advice. Every year, as we enter the winter months, many of us will suffer what are called acute respiratory infections, like sore throats, the common cold and the flu. But how many of us are taking the right steps to treatment and at the right time? Research shows that most people are not aware how long the symptoms of sore throats, coughs and colds and the flu normally last, and often seek medical advice too early, frequently in the search for antibiotics. Antibiotics are not effective in treating most sore throat, coughs and colds and flu infections, and when they're taken but not needed can lead to resistance, meaning that the antibiotic becomes less effective or even useless in the treatment of other infections. Most people will develop an acute respiratory infection, such as a sore throat, a cough or cold, or the flu, every year. Colds and the flu are the commonest infections. Knowing the symptoms and catching them early and using appropriate treatment from the local pharmacist is key to a speedy recovery.
Blocked or runny nose, headache, your body's cold, shivers.
Flu, generally you feel very achy and very unwell.
Normally headache, congestion, runny nose, cough.
All of these are possible symptoms of colds and the flu, but if you're not sure, you'll find a day-by-day symptom checker at treatyourselfbetter.co.uk, where you'll see the symptoms you can expect and how long these may last for. In addition, we've provided guidance on more serious symptoms and triggers that mean you should seek medical advice.
Maybe five days max.
Like a month.
5-6 days.
6 weeks and over, really.
About 3 days.
A week or so.
Because many people are unsure just how long to expect the symptoms of a sore throat, coughs and colds or the flu to last, many see their GP when they don't actually need to. With colds and the flu, the worst symptoms are normally over in 4 to 5 days, with complete recovery in about 10 days, sometimes a bit longer. With coughs, although they can be distressing for you and indeed those around you, and a nuisance because they can persist for several weeks, most acute coughs are harmless and show improvement within about 3 weeks. Sore throats usually improve within 3 to 7 days, and on average, a sore throat will last for about 7 days. Remembering that symptoms can persist, but also knowing the warning signs that may indicate that it's something more serious is important.
Only once, yes.
Yes, I have.
Yes, I have. More than once, I imagine.
Before you visit the doctor, you should first visit your local pharmacist who's well trained to give you advice as to what's best for you and for your family. And usually should be the first port of call if you're suffering with symptoms of a cold or the flu. The symptoms of colds and the flu can vary in severity, but the worst symptoms are usually over in 4 or 5 days. So if your symptoms are not resolved in just a couple of days, then don't panic. Antibiotics are neither necessary nor effective in treating most sore throats, coughs and colds and flu infections, and may contribute to future antibiotic resistance. Speak to your local pharmacist initially for advice and guidance on over-the-counter treatments that can help relieve the symptoms of colds and the flu.